my name is Jewell. I'm a first-year massage therapy student, and this is my pathology project, so I will be telling you all about asthma today. So first off, what is asthma? Asthma is a chronic respiratory disease of the airways in the lungs, which are called the bronchioles. And what happens in asthma is the bronchioles, with asthma, they have a constant state of inflammation. And so they're hyperactive and they're always ready to attack, which is what happens during an asthma attack. When anything triggers an asthma attack, which just could be stress, it could be an allergen, dust, a scent, anything like that triggers an asthma attack. What happens in the bronchioles is that they swell up, as seen here, and they produce an excess amount of mucus. This makes it difficult for a person to breathe, and that's basically what happens during an asthma attack. Sign and symptoms of an asthma attack is wheezing, shortness of breath, coughing, which may or may not be productive, and in some cases, people have difficulty exhaling. The standard protocol for asthma, the standard treatment, is, of course, preemptive, so limiting exposure to the allergens, the scents and oils, anything that could cause or trigger an asthma attack. The bronchodilators, as seen here, which is an inhaler, so you're inhaling the medication, and the bronchodilator dilates the bronchioles, which makes it a lot easier to breathe. Another thing that they use for treatment is corticosteroids. These act as an anti-inflammatory, which helps to lower the inflammation of the bronchioles. And then last here is the antihistamines, which help with allergies. And so with my project, we're talking about asthma and massage therapy. So how can massage therapy help with asthma? So obviously when someone is having an asthma attack, you're not going to be interested in receiving a massage right then. However, before and after can be beneficial for someone with asthma. And when I mean before, I mean it's preventative. We're not having any scents in the lotions or oils or the linens. So this can help ease someone with asthma. As I mentioned earlier, stress can actually trigger an asthma attack. So being able to calm down a person so that they're more relaxed can prevent a future asthma attack, and it can also just bring peace to the person. Afterwards, let's say someone has had an asthma attack earlier in the day, they're going to be much tighter. They may have clenched up. Their muscles, especially those that are affected with breathing, so the diaphragm, the scalenes, and the external intercostals, they are going to be tense. They're going to be tight because they just experienced an asthma attack earlier. We can work to relax those muscles, to open up the chest, and to help bring about easier breathing as well with the relaxation aspect of it. So massage therapy can be a great addition to the medications with asthma. Now, saying that, there has been research done with massage therapy and people with asthma. As seen here, we have some research. There's a lot of research that's been done with children having asthma and receiving massage therapy. In one of the studies, they've shown that children receiving massage showed more lung improvement with the FEV1 and PEF. Now, what those mean is they are measurements of lung functions. So the PEF is peak expiratory flow, and that's a quick and easy way to measure how much a person is able to forcefully exhale after a full inhalation. And the PEV1, which is forced expiratory volume in 1 second. This is a more in-depth measurement that can help diagnose, measure, see the treatments of lung diseases. Below here, we have research with adults. And one of the studies I found have shown with 5 adults. However, they were also, after a few weeks of having massage therapy once a week, they showed similar improved lung functions. And at the end, 4 of 5 of those adults showed that they really enjoyed the massage therapy sessions they received and continued them well after the experiment had been ended. One thing I didn't mention before is the demographics. So how many people have asthma, particularly in the United States? It's actually about 24 to 26 million people in the US have a form of asthma. There are multiple types, which range from mild to severe. And the reason I picked asthma for my project is because a lot of my family members have it, including me. I have a very mild form of asthma called exercise-induced asthma, while more of my family members have a moderate to severe version of asthma. But all in all, that wraps up my project here with massage therapy and asthma. And always remember to relax and to take a breath.